So last time we discussed about how I secured the PCT role and also how it all came about. Now I want to discuss a little bit about how the PCT role looked day to day. At the start of my shift, I would go ahead and get report from the offgoing PCT, and I would figure out what's going on with every patient. Was there anything specific that they would need, or was there anything that they knew that I should be anticipating throughout the shift that I was going to be on? I work night shift just like I do now. I love night shift. I'm such a night shift person. I know it's not the healthiest shift, but night shift really works for me, and I'm like seriously the most night owl person you'll ever meet. So that was the shift. Once report was done, I would go ahead and make rounds on all my patients, and I always had like a little notebook or tablet where I would just write down anything that a patient said that they needed during the shift. So I would ask them, do they need any water? Do they need to get up and use the restroom? Just anything that I can get done kind of quickly while I was making my rounds to make sure everyone was safe and that no one was in dire need of anything. From there, I would go ahead and start checking any vitals that needed to be taken. I would go ahead and apply cryotherapy to any of the patients that cryotherapy was ordered for. I would also start taking the blood sugars that were needed, documenting those, putting it into the chart so that way the nurse could be able to reference it whenever they were doing their assessment. Patient ratios. So on a good day, it would be 1 PCT, me, to 4 patients for my caseload, or it could be anywhere on a heavier day, 1 PCT, myself, and 7 patients. So a 1-to-4 ratio or a 1-to-7 ratio on the heavier side. Throughout the entire shift, one of the things that I was really known for by all the nurses and also the staff, I would really check in on the patients and make sure that if there's any change in patient status, even the slightest patient status change that I knew could negatively affect that patient or their care, I would report that to the nurse immediately. Charting was also a huge part of my role. Being a PCT taught me how to prioritize, how to manage patient care effectively, and also how to work in a healthcare team. It was very hands-on and extremely fast-paced, incredibly invaluable experience, especially while I was in nursing school. This is a part of my PCT series, so be sure to follow along if you're interested in real bedside experience, how to gain that, and different roles that you can have. And as always, this is for your health.